Dr. Charette's protocol. I'm going to start with the pronation protocol. 3 indicators for that would be posterior lateral heel wear, patellar approximation, and positive navicular drop test. We're going to start with the glute medius muscle test to check for cuboid and lateral longitudinal arch. Could you read this, please? Okay, and that's less than a grade 5, so we want to adjust. I'm going to start with navicular. Cuboid. Cuneiforms. Met heads. Talus. Calcaneus. Phalanges. And fifth head. Okay, great. Now we're going to do supination protocol. 3 indicators for that would be positive navicular drop test, the Achilles tendon bowing laterally, and excessively high arches. Okay. So navicular and cuneiforms together. Cuboid, the same as pronation protocol. Met heads, thumbs going out top. Talus. And calcaneus. Phalanges. And fifth head. Okay, we'll retest that glute medius. Okay, and it's a grade 5, so that's great. Hi, I'm Kendall. I'm going to be assessing the knee today. Let's start by taking the patient's leg, leg extension, and pushing lateral medial and medial to lateral, looking for movement. And I'm feeling movement towards the lateral, which means we have a lateral condyle. 3 possible listings are lateral condyle, medial condyle, or posterior tibia. So I'll have the patient flip over, please. Okay. I'm going to find the lateral condyle. And bring the patient's leg past 90 degrees. And I'm going to thrust lateral to medial. Okay, great. And I'll have the patient flip back over to retest that. Okay, and I'm not feeling any movement in that knee, so that's a strong and positive test. Now I'll test the anterior femur. And leg straight up for me. I'm going to push down. Okay, that's less than a grade 5, so we're going to adjust. I'm going to bring the patient's leg up into flexion. Yeah, there's no bed. Make a triangle on top of the knee. And thrust. And now we're going to retest. Okay. And that's a grade 5, so.
Now we'll be performing an alternate talus adjustment. The talus normally subluxates, mostly lateral and slightly anterior.
I'm going to do the big toe, and then next the bunion. Okay, now I'm going to assess the patella. Okay, and I'm feeling movement to the inferior, so we want to adjust superior to inferior. Okay, and then reassess. And I'm not feeling any movement. TFL indicator muzzle. Bring your flag up at 45 degrees and resistance. That's less than a grade 5, so we're going to adjust. We're going to see if it's an internal or external. I'm going to start out by I'm pulling the hip into external rotation, and I'm feeling for springy infield. I'm feeling some springy infield. I'm pulling the pelvis into internal rotation, which means it's an external rotation of subluxation. I'll go ahead and adjust this. Okay, and then we're going to retest with the TFL indicator muscle. Okay, and that's a grade 5. Now I'm going to demonstrate the wrist extension technique. Go ahead and flex both of your legs so I can use the table. Okay, I'm going to use my non-dominant hand flush against the table, and my speed hand making a V over my thumb with about 10 to 15 pounds of pressure. My non-dominant hand will have about 50 to 70 pounds of pressure. I'm going to pull into slight flexion and adjust. Now I'm going to assess the knee and adjust that. So I will assess your right knee. And I'm feeling movement to the lateral, so it's a lateral condyle. I'll have you flip over, please. So I'm going to use my non-dominant hand on the lateral condyle and my speed hand with 10 to 15 pounds of pressure. And then I have you flip over and we'll recheck that. And I'm not feeling any movement. Now we're going to demonstrate that on the femur. So let me put your finger here. Test. Okay, less than a grade 5. So I'm going to find the trochanter and come up 90 degrees into the midline. I'm going to use my non-dominant hand with 10 to 15 pounds of pressure, and my speed hand with about 10 pounds of pressure. And then we'll retest that. Great, and that's a grade 5. So now I'm going to demonstrate that on the shoulder. Anterior humerus. I'm going to push down resistance.